Are they ready for him at CT scan?
Yes, doctor.
Is pharmacy bringing the TPA?
It's ready.
Someone paging Dr. Heide?
Yes.
It's Dr. Heide was paged.
Hello, Dr. Heide. This is Dr. Baxter. I have Arthur here, who is a 61-year-old man. About 45 minutes ago, he became confused and lost his ability to speak and also lost movement in his left side. He has atrial fibrillation and was taking Coumadin and stopped it several days ago because it wasn't making him feel well. He just finished his CAT scan and is coming back from the scanner. All labs are normal, including his INR.
I'm looking at the scans right now, and based on what you're telling me, I think he's going to have an embolic stroke to the right MCA, and there it is. And based on what I'm seeing, I believe he's going to be a TPA candidate. Now, what are his weight and blood pressure?
His weight is 165, his BP is 165/75.
Any other medical problems?
He has diabetes and coronary artery disease.
Any recent surgeries?
No. Well, he's back from the scanner now, as a matter of fact.
Okay, make sure the IV fluids are running. Are we hooked up?
Yes, we are.
Okay then, I'll be right there.
Hello, Dr. Heide. This is Arthur and his wife, Diane.
Arthur, I'd like to ask you a few questions if I may. Can you tell me your name? Do you know why you're here? Okay, Arthur, I'm going to ask if you can look to the right and the left for me. Dr. Baxter, can you assist me with his eye movements, please? Could you lift his left arm off the bed and see if you can hold it up for me, please? Babinski's, please. Diane, I think your husband is suffering from a very large stroke and meets the criteria to receive TPA. TPA is a medication to bust the clot. It is a medication we need to administer as soon as possible after a stroke starts to maximize a successful outcome. There are risks such as bleeding or even death. However, I believe he has a better chance of recovery if he receives this medication. I know this all seems overwhelming, but I would recommend him receiving this medication.
Okay, go ahead, do it.
Okay, thank you, Diane. Do we have the TPA mixed and the 10% bolus ready?
Yes, doctor.
What's his current BP?
147/94.
By my calculation, he should be receiving a 6.8 milligram bolus, followed by a 60.7 milligram infusion over the next hour. Please administer the bolus over 60 seconds. Hang on, Arthur. We're going to do everything we can to make you better. Hello, I'm Dr. Aaron Heide. I'm an experienced vascular neurologist with specialized training in preventing, evaluating, and treating stroke patients. I have started and directed several nationally accredited stroke centers. I have also been involved for several years in the development of telestroke capabilities. What you have just seen was a reenactment of me treating my own father for an acute stroke back in 2009. As a result of our quick action, he completely recovered from his stroke. I do not believe that he would be doing as well if I was not able to utilize telemedicine. It is estimated that 1.9 million brain cells are lost for every minute that a stroke is not successfully treated. Time lost is brain lost. Telemedicine put me at my father's bedside within seconds and thus saved much of his brain. Telemedicine helps create neurology and stroke programs where they do not exist, supports and enhances existing neurology and stroke programs, improves functional outcomes to patients with strokes, and provides many more improvements to the neurology and stroke system. Telemedicine provides 24/7 comprehensive neurology and stroke coverage to hospitals, assists in the recruitment of experts to the region to improve medical specialty independence, and reduces the cost of care for stroke and TIA patients. Telemedicine also reduces hospital stays and readmission rates through follow-up programs. Telemedicine educates and trains physicians and staff on the highest level of stroke care. I believe that proper stroke care requires the highest level of expertise to accurately diagnose the cause of stroke and ultimately determine the right modality in which to treat stroke patients for the best outcome. One size does not fit all, and each patient presentation is different. Having the right medical expertise as fast as possible makes all the difference in the world between a good and a bad outcome. I have assembled a highly trained and experienced group of practitioners who can rapidly and accurately treat patients presenting with neurological and stroke symptoms. Let us show you what we can do.